Good morning. Can you please, or good afternoon, actually, can you please state your full name for the ladies and gentlemen of the jury?
Dr. Cathy Stevens.
How are you currently employed?
I'm employed dually by Erlanger and the University of Tennessee Center for Health Sciences.
What position do you hold for that center?
I'm a professor of pediatrics and also the director of the medical genetics program there.
And as the director of the medical genetics program, can you tell the ladies and gentlemen of the jury what that entails?
Well, I see patients in clinic. I do consults in the hospital. I teach residents and medical students, and I do some clinical research.
Okay. What education do you have that allows you to be a geneticist in your field?
Well, I have a BS in biology from college, University of Tennessee. I also have an MD from the University of Tennessee in Memphis. I have 3 years of residency training in pediatrics, a year of chief residency in pediatrics, 2 years of clinical genetics fellowship at the University of Utah.
And as part of your training and education, did you develop any specialties?
I would say my special interests are dysmorphology and clinical genetics.
Okay. Are you certified as a geneticist in the state of Tennessee?
I am.
And what certifications do you hold?
I'm a clinical geneticist certified by the American Board of Medical Genetics and Genomics. I'm also certified by the American Board of Pediatrics.
So both ways, both for children as well as the geneticist itself? I want to make sure I understand what you're saying. Can you state specifically what your certifications are in?
I'm certified by the American Board of Pediatrics.
Okay.
But then after specialty training, I got certified by the American Board of Medical Genetics and Genomics,
Okay. Are you licensed to practice in any states?
Tennessee.
And in addition to being licensed, are you a member of any professional organizations?
American College of Medical Genetics and Genomics and the American Medical Association.
And just because a lot of the terminology is new to us as non-geneticists, what is the difference between genetics and genomics?
It's an overlap of the whole concept of genetic and genetic diseases and research and all of that. So it's kind of an overlap. They just sort of expanded it to include more over time and added the word genomics to it.
Okay. Do you subscribe to any professional journals?
Journal of the American Medical Association and Genetics in Medicine.
Have you testified as an expert witness in the past?
I have.
Your Honor, at this point in time, the state would tender Dr. Cathy Stevens as an expert in genetics.
Mr. Hood.
No objection.
Ms. Bernard.
We have no objection to her admission, Your Honor.
She'll be admitted as requested, Ms. Fox.
Thank you. I'm going to call your attention to June the 21st of 2022 and asked how you became involved in the case of Jamison Timms.
I received a referral from his pediatrician, Dr. Skifsky, to see him in my clinic.
Okay, so the pediatrician, Dr., I think we've been calling him Dr. Ski, but he gave a referral to your office to see him?
Yes.
And what did you do to prepare for the consultation and evaluation of Jamison Timms?
I reviewed the records that were available to me through the Erlanger system. That's about all I could do.
Okay. Who actually came for the consultation?
Okay, so present were the mother, the paternal grandmother, Lindsay Bray, and Elizabeth Bono of the Department of Human Services.
Okay. And did you list out what specific records were available to you through the Erlanger system?
Well, it was clinical records from emergency room visit, admission to the hospital, laboratory work, x-rays, that kind of thing.
Okay. Did the x-rays in Erlanger show any fractures?
No.
Okay. Did you also have a consultation with the mother, Carrie Timms, in your office? You indicated she was one of the people that came.
Yes.
Okay. When you spoke with her, did you ask about the hematology follow-up in Rome?
Yes.
And what was her response?
She said that it had been recommended that there would be follow-up in Rome, but it had not been done.
Okay. When you reviewed the records, did you note whether or not he had a normal blood workup?
He did.
Is that important to you as a geneticist?
Yes.
Okay. Did you note whether or not he had been tested for von Willebrand's?
He was not at Erlanger, but he was in Atlanta, and it was normal.
He was in Atlanta? Mm-hmm. And what is von Willebrand's for those of us who are not familiar with that terminology?
Well, there's a very complicated, what we call the clotting cascade in the body, so that when you get injured or cut, that you can make a clot and stop bleeding. And von Willebrand's factor is one of those many factors that are involved in that clotting process.
Okay. Were you provided the x-rays that were taken, or the analysis of the x-rays and the x-rays from CHOA?
Yes.
Did you make any personal observations about what you read in relation to the examination you were planning to do?
Well, as it's probably been discussed, he did have some posterior rib fractures on the left. It had a compression fracture at T10. There was no Wormian bones, which you may have discussed. These are like little accessory ossification centers in the back of the skull. There was no undermineralization or thinning of the bones that you could appreciate.
Okay. And why is it important as a geneticist that there are no Wormian bones?
It's a feature of osteogenesis imperfecta.
Okay.
It doesn't have to be, but it often is.
And why is it important as a geneticist to look to see whether or not there was any metabolic bone disease?
Well, I think that's what I was being asked. Is there some reason why these fractures would have occurred in this infant? So I was looking for a genetic reason.
In addition to the surveys from Atlanta, did you also see and have in your possession the second readings, so to speak, that were done at Texas Children's Hospital?
I did.
And when you talked to the mother, did she indicate whether or not she had a genetic disorder?
Yes.
What genetic disorder did she claim to have?
She said that she was diagnosed with hypermobile Ehlers-Danlos syndrome, or EDS.
As a geneticist, having Ms. Timms sitting in the office, what did you do with that particular statement from her?
Well, I asked about her symptoms. I asked about the family tree. Of course, I took an extensive pedigree of the family for any other persons that might have these symptoms, and I did examine her briefly.
Okay. I want to talk a little bit about the examination. What would be the main physical demonstration that would be done on a person to evaluate for Ehlers-Danlos syndrome?
Well, it's a disorder that involves laxity of skin, also laxity of the joints and the blood vessels. So I did what we call a Beighton scale, named after Dr. Peter Beighton, which is a scale designed to quantify how loose is somebody, are they loose jointed? And so I did a brief Beighton scale on her.
What did you score, Ms. Timms?
2 out of 9 possible. The higher the number, the more lax somebody is.
With a 2 out of 9 on the Beighton scale, would she qualify for a diagnosis of EDS?
No.
And can you explain, I want to break down the different portions of that 9-point system, what you're looking for. If we'll just number them 1 through 9, what would be the first thing that would be done when you do a Beighton scale?
Well, do you want me to demonstrate it, or what?
If you can show the ladies and gentlemen of the jury what you're looking for.
So what we do is we have someone bend their thumb toward their forearm, and if the thumb can be laid flat against the forearm, then that's some laxity, and you do that on both sides, so you get a point for each side. Then
and we'll go with her ability on each one. Was she able to do that?
She did do that on both sides.
Okay. What would be the next one?
So then I usually have, you're supposed to have the angle, the elbow at a right angle, resting on a surface, and then you have the hand horizontal like this. I don't know if y'all can see that, but you can push.
Could you do it on the outside one towards the jury? Maybe that would be helpful.
So you do this, and then you pull the 5th finger back. Can you hear me without the mic? Pull the 5th finger back, and at this joint where the finger attaches to the hand, you should be able to go past 90 degrees.
Was
That
she
would be
able to
positive.
do that?
No,
Was she able to do that on either hand?
no.
Okay, what would be the next thing you looked for?
I usually have somebody stand with their arms extended and then tell them to turn their palms upward. And usually people are at 180 degrees here, but people who have laxity will hyperextend and the hand is down lower. And I was not impressed that she had that.
Okay, so she couldn't do that one.
No.
What would be the fourth thing that you would look for on a Beighton scale?
You have someone stand, and then you tell them to straighten their legs and lock their knees backwards as far as they will go. And if they bow backwards, that's a positive sign.
Was she able to do that?
No.
Okay, what would be the next thing that you looked for?
And the next thing is to stand, put your feet together, keep your knees straight, bend straight over, and try to put your palms flat to the floor without bending your knees. She was not able to do that.
What happened next?
That's the total, that's the 9 points. And so out of those 9 points, I gave her this and this.
Okay. Is the joint hyperflexibility something that could be evaluated differently on different days, or you can either do it or you can't?
Probably not differently on different days unless you had an injury to your joint or something and it was too painful or something like that. So it shouldn't vary.
If someone had scored it as high as an 8, would you agree or disagree with your assessment of her performance on the Beighton scale?
I would disagree.
Why?
Well, I just went through what she could and could not demonstrate for me. And so I only got 2, and that's what I gave her, 2.
Is there anything to do with the texture and appearance of the skin when you're evaluating someone for EDS?
Yes, the skin is usually very soft or doughy is the description, and it's hyperextensible. And what you do is you have someone put their arm out, and this part of the skin here on the forearm, you take a hold of it and you pull it up and see if you can pull it up at all. I sometimes check here and here as well, but usually you can see it in different areas where there's elasticity of the skin.
Was her skin elastic?
Didn't seem to be to me.
Did she seem to have those doughy qualities?
Not particularly, no.
Did you look at her sclera?
I did.
Why would you look at her sclera?
Well, the whole question about, bone disease, brittle bone disease, if you will, people may have a bluish tint to their sclera because you're looking through the white layer to the underlying black layer of choroid under there, and it'll look more blue because it's more translucent. Not in every type of OI or osteogenesis imperfecta. And some people with Ehlers-Danlos may have a very light or blue or gray color as well.
What color were Miss Tim's?
It looked normal to me.
Okay. And did you look at her teeth?
Yes.
Why would you look at her teeth?
Because at least half of people with osteogenesis imperfecta also have dentinogenesis imperfecta, which is where the teeth are also affected. They're kind of a gray, brown look, or they may be chipped.
How did her teeth appear to you?
Normal.
When you went through the different things you were looking at, we're going to focus first on the Ehlers-Danlos syndrome diagnosis or not. Did she have any of the things that you would have looked for that would have qualified her for a decision from you that she actually had EDS?
No, not based on what I just described to you.
Okay.
Did she have some symptoms, lightheadedness and things like that she complained about? Yes. But could I demonstrate anything? No.
Okay. Based on your physical observation of her in your office and the different tests that you performed, did you diagnose her with EDS?
I did not, but I did not fully unclothe her and do as in-depth an evaluation had she been my own patient.
Did she try to show you any scars?
Yes.
Why would that be relevant for an EDS diagnosis?
Because scarring tends to be abnormal. Usually we knit up our skin really nice, thin scars, but people with EDS, it'll kind of stretch and look more wide and wrinkly looking like a poorly healed scar.
And what scar did she show you?
I think she had one on her elbow. I can't remember. It didn't look impressive.
Did it have the characteristics that you would associate with EDS?
No.
Why not?
It didn't look like I just described.
Okay. What about hearing loss?
Well, hearing loss was more for the osteogenesis imperfecta question because a significant number of adults with brittle bone disease will have some hearing loss over time.
Did you receive any complaint from her as to whether or not her heart had any issues?
She told me that she saw someone, I don't know if you want me to, she saw someone in Boston who said she thought she had a click in her heart, but she had not had an echocardiogram.
Why would you need an echocardiogram for a click?
Because that's part of the, it's suspicious for mitral valve prolapse, which is a floppy valve in the heart. But on the criteria for hypermobile EDS, you have to document it by echo to meet that criteria.
Were you given any genetic testing that had been ordered by CHOA?
Yes.
And what was significant about the testing that you were provided for your analysis?
It was a test that was sent from CHOA to the University of Washington in Seattle, and it was for the 3 common genes associated with osteogenesis imperfecta, the types that we see that are not like devastating types that you would know the second you walk in the room. They're the common autosomal dominant OI, osteogenesis imperfecta genes. 2 of them had no changes, no abnormalities in them. 1 had what we call a variant of uncertain significance in the collagen 2A1, 1A2.
I'm going to take them one at a time. If we're going to label the first one coli A1, was that normal
It was
or abnormal?
Normal.
If we're going to label the second one IFIT-M5, was it normal?
Normal.
Or not normal?
Normal.
If we're going to label the third one COL1A2, was that gene normal or abnormal?
There was a variant of uncertain significance noted in that gene.
Did you look into that further?
Yes.
And can you explain first in plain English so that us that are not geneticists would understand what a variable of unknown significance is
Okay.
and what it means in a medical setting?
Okay. So the way I think about it, and the way I explain it to people is a gene, it has usually thousands of letters that make up its code. It's very specific to the gene. If you change one of the letters, 2 of the letters, 3 of the letters, that's called a variant. So it's different than what we normally see. But the variant sometimes doesn't hurt the gene at all. The gene couldn't care less. It works just fine. You would never know it's there. That's a benign variant. We don't care about those. They don't do anything. And we all have a bunch of those. Sometimes if you change the letters in the gene, then that variant sometimes will make it so the gene can't work anymore. It disrupts the gene. That's called a mutation. And those are important to know about. Then you would have whatever goes with that gene, whatever disorder, because that's a mutation. But if you have a change in the gene, a variant in the gene that there's not enough data, there's not enough scientific evidence to say that's a benign variant, don't worry about it, don't pay attention to it. Or that's a harmful variant, a mutation, pay attention. If there's not enough data to say which one is it, we call that a variant of uncertain significance, kind of in a gray zone. We do not attribute disease to those. We do not make medical decisions based on those. We see them all the time. I see them all day long in my clinic. And when they get reclassified, eventually, over the years, more data will come in, more patients will be in these databases. Most of them turn out to be benign.
Okay.
Not all, but most.
When you have a variable of unknown significance and you're looking to include or exclude certain syndromes or conditions, do you then look to the physical characteristics of that person to see whether or not they have those conditions?
Yes,
Did you do an assessment of Jameson in this case?
I did.
Can you tell the ladies and gentlemen of the jury what physical exam you did and what the results, if any, were?
Well, I examine people from head to toe when I see them in my clinic. From the top of their head, we feel the soft spot in the baby. We look at the hair, the facial features, the eyes, the mouth, the teeth, everything, all the way down. Listen to the heart, examine the abdomen, look at the limbs, do a neurologic exam, muscle tone, reactivity, skin exam, all of that.
And in Jameson, how did he appear when you did that type of an examination on him?
I didn't find any. He looked like a normal, healthy child to me.
How old was he when he was in your office?
8 months.
Did you look specifically as to whether or not the fractures he had experienced when he was younger had healed over time?
Clinically, I didn't see any bowing or any deformation of any of the limbs, and the x-rays had healed by that time.
Did you specifically look to the blood work to see if there had been any abnormalities that would have led you to believe that he needed a particular diagnosis genetically?
No.
Did you understand whether or not he had a history of some unexplained bruising?
Yes, he did.
What did that mean to you genetically when you looked at whether or not this variant would cause or not cause those issues?
I don't think the variant had anything to do with that.
Okay. What about the fractures?
I don't think the variant had anything to do with that either, the best I know.
Why not?
Because a couple of things. One is there were no clinical findings to suggest that he had osteogenesis imperfecta. There was no family history of it, although you don't have to have a family history. And then subsequently, the parents were studied for the variant. And that's the other thing that we do when we see a variant of uncertain significance. We look at that gene and say, well, does that gene do something that makes any sense for this child, or is it just a fluke? Or two, we look at the parents to see if one of them is carrying that variant. And if it comes from a healthy parent, then it's more evidence that it's a benign variant that's just being passed through the family.
Is it important whether or not the fractures healed in the normal time frame?
Yes.
Is it important whether or not there were no new breaks or bruising while he was not in the home of the parents?
Yes.
Why is that important?
Because if he truly had an underlying genetic disease like osteogenesis imperfecta to give him that many fractures before he was even walking, he would have gone on to have more fractures in a different home.
Did you find it significant as to the fact that he had no Wormian bones?
Well, again, it's one of those things we look for in OI. If they were there, it would be important, but if they're not there, it doesn't necessarily mean it is or it isn't OI.
Did you look to see whether or not he had any osteopenia?
So osteopenia means that the bones look kind of thin, like an older person's bones. I did not see anything, and the radiologist did not read anything.
Did you personally examine those scans for those details?
Yes.
And what is the significance of not having that thinning
Oh, well,
in regards to a diagnosis?
you can sometimes see that with osteogenesis imperfecta. You don't always, but you can.
What does it mean that the variant of unknown significance is non-diagnostic?
It means that it's probably, it's not a definitive answer to anything. It's just one of those little changes in the gene that may or may not mean anything. And the assessment of that variant by the lab using their computer programs and data and all that, and says this right in the report, is not predicted to be pathogenic, or it's not expected to disrupt the way that gene is functioning.
Did you follow up with the blood doctors to see if there needed to be any additional testing?
I referred them to go back to our hematologist to make sure there wasn't any reason for the, bleeding, bruising issues, and they did not keep that appointment.
Okay. Did you look to see whether his factor 9 was normal on subsequent reports at CHOA?
It was.
Did you try to do a more thorough gene panel in this case?
Yes, the mother wanted me to do more testing, and she had been told that someone in Amsterdam told her that we hadn't done enough genetic testing. So I said, well, we can do a more expanded panel, a bigger panel than the 3G panel, which I did.
And how many genes did the expanded panel test?
24.
And did you receive the results in your office?
Yes.
What were the results?
It showed the same variant of uncertain significance in the collagen 1A2.
Was it sent to the same lab that did the 3 panel or a different lab?
Different lab.
Did the different lab also call it variable of unknown significance?
Yes.
Did you read the entire report?
Yes.
Did you see anything in it that would account for why Jameson would have had broken bones in the first couple weeks of his life?
No.
In regards to osteogenesis imperfecta, what did your personal examination of Jameson reveal?
I didn't find anything on his physical exam and nothing on his genetic testing or his x-rays.
Did you look at his eye whites?
Yes.
What color are Jameson's eye whites?
I noted that they were very, very light blue, which can be normal up to about 18 months. I see it all the time in kids.
Okay. Did you look at his teeth?
He didn't have any.
So at 8 months, his teeth aren't coming in yet?
They were just peeking through, so there wasn't enough for me to look at.
Okay. Did you look to see whether or not he had bowing limbs?
He did not.
He did not. Why were you looking to see whether or not his limbs were bowing?
Sometimes with osteogenesis imperfecta, when you get healing of the bones, they don't always heal in a straight line. They may become curved or bowed.
Did you personally examine whether or not his skin was thin or stretchy?
Yes,
And what was the results of your assessment of his skin?
it seemed normal.
Based on the 24 gene panel results, your observations and examination of Jameson, would you have made a diagnosis of osteogenesis imperfecta on Jameson?
No,
Why not?
nothing on the physical exam, nothing in the DNA testing that was important, nothing on the x-rays, so no.
As to the Ehlers-Danlos syndrome, is it medically possible to diagnose an infant with that syndrome?
No, you're not supposed to diagnose it under the age of 5,
Why not?
because almost always children are very flexible. If you handle them, they can move around a lot more. Their skin may be a little more flexible. So we're really not supposed to diagnose it under the age of 5.
Did you see any convincing features in Jameson's mother that would make you think he had inherited an EDS syndrome
In her,
in her?
no, as I said, she only had 2 out of 9 points on Beighton's scale, and skin findings were not that impressive to me.
Is there a genetic test for hypermobile EDS?
There is not.
Is it the only type of EDS that currently does not have a genetic test?
That we know of.
Okay. Is there a medically accepted criteria that should be followed before diagnosing someone with EDS?
Yes.
What is it called?
Well, and I don't know if y'all have already talked about this, but there is a scale. This is a diagnostic criteria for hypermobile EDS that every geneticist I know uses, and it gives you all these very detailed diagnostic clinical criteria. Because we don't have a gene test, we have to go by clinical criteria, meaning you examine someone and you get a history and you rule out other things, and you do this Beighton scale I was showing you a minute ago. So then you score somebody on this sheet.
Based on her low score on Beighton, the fact that her scarring appeared normal, the fact that she did not seem to have the doughy skin, did you even complete that assessment of her?
No, I just did a brief assessment of her.
In the medical geneticist community, is there a correlation between broken bones and EDS?
It's been controversial whether or not that adults might have some increased number of fractures, and maybe even some older children, because once they become ambulatory and they're running around playing, they fall more because they're unstable. But with infants, no data at all, no indication that infants should be more breakable.
Is it even part of the criteria to determine whether or not someone under age of 5 would even have EDS?
No.
In the field of geneticist, is there anything called temporary brittle bone syndrome?
That was something that was started several years ago by someone, and it has been debunked.
Okay. Based on your review and medical records, your observation and examination of Jameson, would you make a diagnosis of Ehlers-Danlos syndrome on Jameson?
No.
Why not?
He's too young, for one thing, and he didn't really have anything that physically that made me think of it anyway.
Did you see anything that would indicate he had any metabolic bone disease?
No.
What would metabolic bone disease be defined as?
It's kind of a broad paint, metabolic. We see it, when I use that term, I'm usually talking about extremely premature infants that end up with, rickets and problems with their alkaline phosphatase and all of that. That's what I call metabolic bone disease. But if you're talking about genetic bone disease, that's a much broader condition.
Did he have anything that would indicate that he had any metabolic bone disease?
No.
Did he look like he, based on your examination of the medical records and your physical examination of Jameson, did you see anything that would indicate he had a vitamin D deficiency?
No.
What would that mean genetically?
Well, he had a vitamin D level that was normal, for one thing. And he did not have, on his x-rays, features of vitamin D deficiency, hence rickets. There are certain x-ray findings that we see, and he did not have those.
Based on your review of the medical records, the additional genetics testing, your observations and examination of Jameson, did you see anything genetically that would account for the 3 rib fractures and the compression injury to his spine?
I did not.
Is it important that he did not break after he was removed from the family's home?
Yes.
Your witness.
Mr. Hood?
Good afternoon, doctor. How are you?
All right.
So you met with Jameson in your office, was it in Chattanooga,
Yes.
in June of what year?
June of 22.
Okay. And how long did that meeting last?
Usually about an hour.
And was that approximate hour, is that the only time that you've spent with this young man?
Yes.
And are you aware that he has been under the care of a pediatric geneticist since February of 2022?
Yes,
Okay, do you know who that is?
I am now. It wasn't shared with me at the time I saw him.
Okay. Do you know who that is?
I do.
Is it a doctor that you're familiar with?
I know of her. I don't know her personally.
Okay, and she's in Atlanta, is that correct?
Yes.
Okay. And I would presume that you would agree with me that you would get a better feel for the condition of a patient after treating that patient for 2 years than in 1 hour. Is that correct?
Sometimes.
Okay. And do you have any idea how many times this child has met with Dr. Vidya Krishnamurthy, who is the pediatric geneticist in Atlanta?
I think there were at least 3 or 4 times, but I don't know personally how many times she met with him.
You don't know how many hours they've spent together?
I don't.
The COL 1A2 variant, do you know how this child inherited that? From whom?
From the father,
And who did he inherit it from?
from his father.
And do you know anything about the health conditions of the paternal grandfather?
I know what they shared with me when I met with them.
Okay, what was that?
Okay, this is what she told me. He was not there, the father was not there, the mother told me this, that he had had some fractures after a motorcycle wreck and he had had some sprains. He was 6'2". They couldn't find a picture to show me. I asked to see a picture of him, they couldn't find one on their phone. The paternal grandfather apparently had some fracture with trauma, and that's all I know.
So you were not aware that the paternal grandfather was diagnosed with scoliosis?
It's not written on my pedigree, so no.
Okay. And you were not aware that the paternal grandfather suffered early hearing loss?
No.
And would those be significant findings for you?
They could be. Scoliosis, not as much. It's so common in the general population. And hearing loss is the most common genetic disorder in the population.
Okay.
So,
Over the past 2 years, do you know what color Jameson's eyes have been?
in the
terms-
last 2 years?
Yeah, in terms
I have
of the
not
scope.
seen him in 2 years.
So if he has shown up at Dr. Krishnamurthy's office with consistently blue sclera, would that surprise you?
Yes.
Would you have any reason to dispute that?
I didn't see that described in her notes.
Okay. Variant of unknown significance. You indicated that it's something that may or may not be significant,
Correct.
correct? And you indicated to Ms. Fox that it's not anything that you would use to make a medical decision or a medical diagnosis. Is
Correct.
that correct? You understand that those people sitting over there are not being asked to make a medical decision, they're being asked to make a legal decision. Do you see the distinction?
Yes.
Okay. I'll ask you a question that I asked Dr. Brown from CHOA. Assume weeks from now, months from now, years from now, all the data that needs to be in is in. And we find out that this variant at COL 1E2 is in fact pathogenic. Would that change your opinion on this case?
Well, then why wouldn't the father have a Y and the grandfather have a Y? Because they have the same variant.
Yes or no?
Would it change my opinion?
Yes.
Yes, it would. But I just don't think that's going to happen.
Okay. You're gambling that it won't.
Say it however you want. I have to make those kind of judgments every day.
Okay. And they're asking them, most importantly, to gamble that it won't. Right?
That's your part. I'm just telling you medically how I look at it.
But that's the reality. Nobody knows as we sit here whether that's going to be pathogenic or not, do we?
It's pathogenic. That's the word.
Okay.
Pathogenic.
Pathogenic. We don't know, do we?
We can make an educated assessment, and that's what the people in the laboratory do, and that's what the clinicians do.
Okay.
We have to, because we see them all the time.
And their educated assessment as we sit here today includes the word unknown, correct?
Variant of uncertain significance.
Okay. That's their assessment today.
It is, but if you look at their report, it goes on to say this variant is unlikely to cause any problems with RNA production.
Well, how unlikely is unlikely?
I don't have a number.
10% chance?
I don't know.
20%?
Don't know.
30? 40?
Make it up. I don't know.
I'm asking you. I'm not the expert on genetics.
I'm telling you, as an expert, I don't know.
No way to know right now, is there?
I think it's unlikely. So if you're going to say, is it greater or less than a certain amount? Less than.
Okay. No way to quantify that is my question.
Pick
Right.
a number. I'm telling you how we practice and how we deal with uncertainty. We deal with uncertainty in medicine all the time, and you have to make an educated assessment when something comes back uncertain. Just like when your relative is ill and blood work comes back and it's not certain, you have to say, well, does it make sense or not? That's what I'm trying to do.
But y'all, and when I say y'all, I'm not just picking on you. I mean, the folks who have sat before you on that witness stand seem perfectly willing to assume that it's going to come back benign, but give no thought to the other possible assumption. Just rule that out. Can't happen. Is that your position?
I'm saying it's very unlikely. That's all I can tell you.
But you can't tell me what unlikely means.
Can you?
I'm asking you, ma'am.
I don't know. I made an educated judgment based on my training and experience, based on what I know about genetics, and you don't, that it's probably benign.
Okay, thank you.
Ms. Bernard?
Yes, Your Honor.
Good afternoon, Dr. Stevens.
Hi.
All right, so you work at Erlanger Hospital as well as University of Tennessee, right?
Correct.
Okay. And Erlanger has T.C. Thompson, which is the children's hospital component, right?
Yes.
Okay. And since you are a professor of pediatrics as well as genetics, how much of your practice would you say is over at the children's hospital?
I do full-time genetics, if
Okay.
that's what you're asking me. And I see patients in clinic associated, the clinic building that's associated with Children's Hospital. I also see inpatients who are actually in the Children's Hospital.
So what percentage of your work involves cases like this, where you have a family coming in with members of DFACS and other state officials who've already made accusations against them, and they're coming to you to see whether those accusations are correct or not?
I don't know the percentage. I mean, I see them not uncommonly.
So this was not the first time that you had seen a mom and a grandmother come in with two DFACS employees?
No.
Okay. So these two DFACS employees, what was their role during the examination that you just described?
They were just observing.
Did you speak to them at all?
I introduced myself and found out who they were, but I don't remember discussing anything with them.
So let's go back to how you prepared for the appointment that was in June of 2022, right?
Right.
Okay. And this was the only time you ever saw Carrie Timms or her son Jamison Timms,
Yes.
right? So how long in advance of that visit were you given any information about Jamison Timms and his medical records?
Usually I'll prepare for patients a day or two or three in advance, depending on my time.
So who provided you with the information about Jamison Timms?
Well, a lot of it was in our electronic record system, and that's where I started my review.
So who directed you to start that review of the medical records for Jamison Timms?
I direct myself. I see them on my schedule, and I direct myself to review it.
Okay. Well, so I suppose, did he just pop up on your schedule, or did you have any additional information before he popped up on your schedule?
Well, I have people who will collect records for me and do, some stuff and put it in a chart for me to review. And then I go to the EPIC record, which is the electronic record, and look at all the x-rays and labs and stuff myself.
Okay. So did you ever talk to a Dr. Carla Garcia?
Maybe after the fact, but not before this.
Okay. Did you talk to anybody else before the visit with
No.
Jameson? Okay, so just Jameson Timms pops up on your schedule for the day. You get prepared by looking through all of his records, and there's no conversations with anybody, just review of the records.
Correct.
Okay. And so those records contain things like Dr. Verena Brown's consult notes from CHOA in January of 2022, right?
I'm trying to think if I had those when I saw him. I'm not sure that I did.
Okay. And they did contain the records from the November 2021 visit where Ms. Timms brought Jameson to Erlanger Hospital, right?
Right. Well, I can see it in EPIC.
And did you think it was interesting that they spent so much of that report documenting how Ms. Timms had complained about the cleanliness of the room?
I don't know what you're talking about.
Okay, let me grab our medical records. Okay. And I'm using page 90, I think. Your Honor, if I could approach the witness?
Certainly.
So, I'm showing you the medical records on page 90. This is from his consult at Scottish Rite, and in the history, it cites the December 8th note from Erlanger. Is that something that you recall reading when you were reading the records from
No.
Erlanger visits?
I've not seen this.
Okay, so you did not see the notes from the December visit to Erlanger?
You mean when he was hospitalized in our hospital?
Right, well, they brought, Jameson was brought to Erlanger in both
Right.
November and December of 2021, right?
Right.
And so what I was showing you are some of the consult notes from the December visit to Erlanger, right?
I have not seen this particular note.
Okay, so you had not seen that particular?
No.
Oh. So were you aware of the blood work that had been done at Erlanger for that November and December 2021 visit?
Yes.
So were you aware that that blood work had been lost?
No.
Okay. Had you been able to review any blood work records from that visit?
In the electronic record, you just click on labs, and every lab comes up, and that's what I look at. Same with x-rays.
And I suppose it did not mention any of the labs or blood work being lost from the November and December visits?
Not that I saw.
Okay. I know these medical records, they probably come in all sorts of different formats, and it's just wanting to make sure we get everything straight. So you were not aware of the blood work being lost?
No.
Did you do any comparisons of the results that were received from any testing from the Erlanger visits in late 2021 to the Children's Hospital visits in January and February of 2022, all the way to your visit with Jameson in June of 2022?
Yes.
Okay. And so that's where you located some of the abnormal results on the factor IX assay, for example?
Correct.
And just to make sure, but you were saying the abnormal result on the factor IX assay was not relevant to any of the conditions Jameson may have had?
By the time I saw him, he had had it repeated in Atlanta, and it was normal.
But the fact that he had had an abnormal reading at an earlier point in his life when these injuries are alleged to have been inflicted, is that something that was relevant to your diagnosis or consideration?
It has nothing to do with osteogenesis imperfecta
Well,
or Ehlers-Danlos. It had to do with the bruising that he had.
Okay. So let me, I guess I want to understand, when you were seeing Jameson, was your role to find out what was going on? Was it solely to test for osteogenesis imperfecta? What did you see as your role when you were visiting, when you were seeing Jameson Timms as a patient in June of 2022?
To see if there was an underlying genetic reason why he had fractures without explanation.
And so were you aware that all as early as March of 2022, that there were individuals who were swearing before a judge that doctors had already ruled out any kind of genetic condition that might have contributed to his fractures?
I only knew about the initial DNA study that was done, that it was non-diagnostic. But beyond that, no, I didn't get those records till much later.
Well, so when was the initial DNA study done, and who was that done by?
It was done, ordered by Dr. Brown at CHOA when he was admitted there.
And did you look at those results prior to your meeting with Jameson?
Yes,
Okay. And so that's where you discovered that the variant of uncertain significance had been
yes,
located. And in the genetic testing that you repeated, that same variant of uncertain significance was also present, right?
correct.
So it's fair to say no one is disputing that there is a variant of uncertain significance on the COL1A2 gene in Jameson Timms, right?
No, and he had 2 other genetic tests done too that were not shared with me until this attorney sent them to me.
Well, and I'm just trying to understand, does that in any way make you doubtful about the result of the genetic variant?
They've all showed the same thing.
Okay. So what is this genetic variant that they're showing?
Do you want me to get really specific?
I do.
It's a little variant in intron 9, if I remember right, and it's not in the exon. And again, here we go with science, but
Well, can you tell us, first of all, because the word intronic is used in
about to.
extron, so if you can tell us what that means
Right.
first, please.
so exons, part of your genome, you got these exons, and those are the parts that code for proteins. It's only 1% of your genome. In between the exons are intronic regions, and that there's a little change in one of his intronic regions.
Okay, which intronic region was it?
I think it was 9. I can get the report out if you want me to look.
That would be wonderful.
Okay, here it is, right here. Yeah, intron 9.
Okay.
I don't know that that means anything to anybody, but it's number 9.
Well, so in the course of your research, have you had occasion to research that particular intron?
No.
Okay. Have you reviewed the work of any geneticists who have researched that particular intron or other introns?
Nobody does research on one little intron. It's just part of the global research for OI mutations.
Okay. So are you familiar with the work of Dr. Gerard Pauls of the University of Amsterdam and the University of Jakarta?
Not really, no.
Who would you consider some of the foremost experts on the genetics of bone disorders like osteogenesis imperfecta?
Peter Byers comes to mind. Dr. Byton, maybe. I mean, there are umpteen people working on OI in the world.
Well, are you familiar with any databases that have been created to track these genetic variants and study the specific variants to see if they have any significance and determine if they are going to be benign or pathogenic?
There are many databases of variants.
And so is that something that as part of your work you keep track of?
We use them when we need to. You know, if we see a variant that we want to update, like let's say I saw a patient a couple years later and we say, well, let's get that variant out and see if there's something online I can see where that variant's been reclassified. Yes, we do that.
Okay. And so this variant on, I'll make sure I'm saying, so it's a variant on intronic region 9 on the gene? Is that an accurate way of saying it?
Yes.
So did you, in the course of making your evaluation of Jamison Tim's specific genetic circumstances, did you have occasion to go to any of those databases and review whether or not that particular variant had been located in any other patients or cases?
No, that's what the lab does for us, fortunately,
Okay.
because they have people who sit all day long and do that. And this was looked at in 2 different very good labs a couple of times, because different tests kept getting ordered on the child. And so the same sort of analysis was done each time, and they collect all that information and they put it in the report for us. But sometimes I do it myself, too.
Okay. But in this case, you just relied on what the lab
Correct.
had told you. Did they provide you with any additional information about the specifics of this genetic variant?
Like what?
I mean, that's what I'm asking you, you know?
No.
So I want to drill down on the information that is available to you about the variant of uncertain significance. We know it's on intronic region 9. What else do we know about it from the results?
Well, the interpretation was that it was unlikely to affect splicing, which is where you're kind of transferring DNA into RNA, and it cuts in different regions and translivers, and the interpretation was that it looked unlikely to be harmful in that process, which means it looks benign.
Well, so does something have to affect splicing in order to be harmful?
No, but usually.
Okay. So the finding from the lab, they said that it was unlikely to affect splicing, but it doesn't need to affect splicing in order to affect the patient and the patient's outcomes?
I don't know in that particular intronic region if it has to or not. I do not know. That's where we have some trust in our laboratory colleagues. They're the ones who do that all day long. I'm the one sitting with the patient.
Well, I don't know that the state intends to call any of the individuals from these labs, so I'm afraid you're what we've got, Dr. Stevens. So they didn't tell you anything else unless that it was unlikely to affect splicing?
That's all I know. It's whatever was written in the report, yes.
Okay. So do we know anything of that area, how it impacts collagen production?
I don't know the detail of that, no. Collagen is a huge, complex molecule, and I wouldn't know intron 9 where to find it on that huge, complex molecule.
And collagen, we've got collagen in our bones and in our skin and in our blood vessels and in our nerves and brain and everywhere else, right?
Well,
I don't know about the brain.
I don't know about the brain.
But basically all of the physical structures
A
of
lot
your
of
body
them, yes.
contain collagen.
Yes.
But we don't know how this variant on intronic region 9 affects collagen production or expression.
Correct.
Then how can you rule out any impact on bodily processes that are dependent on collagen production here?
I'm trusting my laboratory, very learned colleagues that it doesn't look like it affects the function of the gene, okay? And I'm telling you, I'm making that judgment that I'm going to trust what different labs have told me, the same thing, and it's tracking through the family. You've got 3 generations of people with the same variant, and they don't have this.
Well, but none of those people were x-rayed as 1-month-old and 3-month-old, were they?
That has nothing to do with it.
Well, I respectfully disagree, doctor. I mean, we are talking about, and if I could get these demonstratives out. Actually, could I ask the witness to step down and look at our demonstration?
You can, and do you need the easel?
That would probably
Okay.
make this
Would you-
honor, especially
yeah.
for the folks.
Mr. Hood, if you'll pass that over, if y'all pass that over to her. And doctor, we're gonna let them set the easel up. We did this earlier today. They set
Okay.
the easel up so they could put the demonstrative up so the ladies and gentlemen of the jury could see what you're looking and talking about.
So if I could ask you to step down,
Sure.
doctor, so that we me look at the demonstratives. Okay, actually, let's just go ahead and, sorry, can I wheel you around a little so we're not blocking the jury? Okay, so I'm showing you what's been marked as Defense Exhibit 1, which is a blow-up of 6GG States Exhibit, which is from the January 14th scan at Children's Hospital of Atlanta. Do you note any abnormalities or irregularities here?
This was done in Atlanta.
This was done on January 14th in Atlanta.
I believe they read this one as well. No, that was, no, I'm sorry, the months mixed up. But this was a little, I'm not a radiologist, you know, so I'm not really qualified to read this, other than what I look for, which is bone density, bowing, worming in bones, things that geneticists look for. If you want a radiology interpretation, you need a radiologist.
Did you notice any flaring on the ends of the ribs when you were looking at the scans? Okay. So did there appear to be anything abnormal about the scan?
I'm not going to read it as a radiologist. You're not going to get me to go down that path.
Okay. I thought you had testified earlier that you had reviewed the
I did.
scans. Okay. And you drew conclusions about those scans,
Based on the
correct?
facts I just told you.
Okay. Well, this is the scan. And so
There's no osteopenia, there's no bowing, there's no fraying, there are no wormings. I can't see the back of that.
Okay.
But the things I look for, there's no dwarfism, there's no osteopenia, those are the things I look for.
okay. I mean, can you even see any irregularities or healing calluses in the
I'm not
scan?
going to go down this path with
Okay.
you. It is what it is, I'm not a radiologist.
All right. Well, so can you tell me, and here I'm going to show you what's, sorry, that's 9. I'm showing you, this is Defense Exhibit 5, which is states, a blow-up of states 5E. And this was from a scan at Erlanger Hospital on November 18th of 2021. I knew that was going to happen. All right. So when you say that you are looking at the bone density on the scans, what are you looking for to see whether bone density is normal or if there is something abnormal?
So I'm using bone density loosely because what we're looking for is radiolucency, where the bones look thinner, not as dark, white as they should be. And actual bone density was not done until this child was a couple of years old and it was normal.
Right, because as we understand it, you can't do the DEXA scan on a tiny child. Okay, so did you notice anything irregular about bone density for these?
Bone density, to my eye, was okay.
Okay.
I'm not a radiologist.
And all right, this is, I'm showing you Defense Exhibit 2, which is a blow-up of States Exhibit 6HH. This is another one of the Children's Healthcare of Atlanta scans from January 14th. Were there any irregular findings to your eye, recognizing that you are pediatrics and genetics, not a radiologist? This is just based on what you have previously testified to as reviewing radiology to draw your conclusions about James and Tens. Does there appear to be anything?
I have nothing to add.
Nothing to add. All right, we've got Defense 3, which is a blow-up of State 6FF from Children's Healthcare of Atlanta scans in January of 2022. Anything about bone density here?
Not bone density, no.
Okay. So the ends of the ribs all look the same?
I'm not going to talk about it.
I guess.
You can call a radiologist and they can read it really well.
Your Honor, I suppose at this point, the witness had previously offered an opinion based on her reading of radio.
Time out just a minute. I want to ask the ladies and gentlemen to do the steps of the jury room, please.
So Dr. Stevens, are you able to see from the witness stand here, or would it be easier to come around? And I'm currently displaying what's marked as Defense Exhibit 6, which is a blown-up version of States 5E, which is a scan from Erlanger Hospital in November of 2021. Did you see any evidence of bone thinning or bone density abnormalities in this scan when you read it for the first time, or now that it is blown up? No. Okay. So. All right, I'm showing what's been marked as Defense Exhibit 7, which is a blown-up version of State 6FF from January 14th at Children's Hospital of Atlanta. Do you observe any signs of bone density issues or bone thinning in this scan? I'm showing you what's been marked as Defense Exhibit 8, which is a blow-up of States 5HH from Erlanger on December 8, 2021. Do you notice any evidence of bone density, bone thinning, or bone fraying issues in this scan? I'm showing you what's been marked as Defense Exhibit 3, a blow-up of 6FF. This is from Children's Healthcare, January 14th. Do you notice any evidence of bone density, thinning, or fraying in this X-ray? I'm showing you what's been marked as Defense Exhibit 2, which is State 6HH. It's from the January 14th scan at Children's Healthcare of Atlanta. Do you notice any irregularities in bone density, thinning, or other indications relating to osteogenesis imperfecta in this scan? This is Defense Exhibit 5 from Erlanger, November 2021. Any evidence of bone thinning, bone density issues, fraying, or other irregularities of the skeletal system? Do you notice any of those? No. And actually, first, this is Defense Exhibit 1 from State 6GG, January 14th scan at Children's Healthcare. Any bone density or irregularity issues here?
You're using the term irregularities to me, that means anything abnormal.
Anything abnormal, particularly in the realm of bone density, bone thinning, or the other items to which you previously testified? No. Anything on the ends of any of the ribs? And then this is Defense Exhibit 9 from CHOA on January 14th, States 6EE. Same question, any evidence of bone density or irregularities at all?
Okay, so what was your basis for concluding that there was no undermineralization of Jamison Tim's bones?
As I said before, that's based on a plain film like this, where you don't see the translucency that you sometimes see in kids that are undermineralized, like kids with rickets and things like that. And later on, a bone density test was done, which was normal. But those films are just plain films that you're just looking at.
Okay, so you did not see any translucency or irregularities in the scans from November of 2021, December of 2021, or January of 2022?
I'm not commenting about the fractures, and to me, that in part of, when you say irregularities, it means abnormalities. There were fractures there. But I'm not going to characterize those because I don't feel like I should.
Certainly, and I can be more precise in my question. In any of the x-rays that we just went over, did you see any evidence of translucency or other factors that might make you consider undermineralization of the bones at that stage in Jamison Tim's life?
No.
Is it your understanding that an x-ray will always be able to show evidence of bone density or undermineralization issues?
Not always.
What is your understanding of the role that collagen plays in bone strength and formation?
It's like a very complex mesh that intertwines the collagen molecules, and it gives strength to the bones.
And is that something that would be visible through an x-ray?
No.
Would there be any type of testing that would be able to determine the amount of collagen fibers present in a bone?
They could probably do it if they took a biopsy and did some staining.
A biopsy would, of course, require like slicing off a piece of the bone.
Correct.
Which would be an undesirable way to treat a child.
Correct.
Okay. So, as you know from the report that you prepared regarding Jamison Tim's circumstances, he was a premature baby, right? He was
He
born.
was 37 weeks.
Okay, and so that is several weeks premature.
We consider full term usually 38, so 37 is pretty close to term.
Okay, and his birth weight was approximately 5 pounds 7 ounces.
I'll have to look back at my note. Let's see. 5 pounds 15 is what I have.
Okay. And have you ever had occasion to review or study any rib fractures that have been a result of the birthing process?
No, there have been in utero fractures from the devastating lethal type of OI that I've seen. And some of those may occur during the birth process too. They're just crumpled.
Well, and I guess does someone have to have some form of OI in order to have a birth injury like that?
No, we frequently see clavicle fractures, collarbone fractures.
Okay, so birth injuries can occur even in a child that does not have osteogenesis imperfecta. Is that correct?
Yes.
Is the physical size of the mother any kind of factor in this sort of thing?
You mean a fracture?
Right.
It depends how big the baby is, how big the mother is, how difficult was the delivery. Was it a repeat delivery or first baby? There's so many factors that go into that.
Okay. Would any medications that the mother was taking, such as beta blockers or anti-nausea medicine, would that have any potential impact on that process?
No.
What do you consider a normal level of vitamin D for an infant?
I'd have to look at the scale, but usually to be really deficient, they'd be under 20 or so, but I'd have to look at the exact number.
Would an infant whose mother was having trouble breastfeeding and have to switch to formula, would that potentially involve any nutritional deficiencies that might impact bone structure?
Well, usually formula has more vitamin D than breast milk.
Well, right, but would the fact that the child was not immediately on formula as soon as he was born create any issues?
I don't think so. We would see so many kids broken if that were the case.
Well, and you mentioned broken, and I know you're not an orthopedist, but you are, in pediatrics and genetics. When you are looking at a fracture, what are the ways that you determine whether it is the result of inflicted trauma?
Well, there are certain kinds of fractures that are thought to be more suggestive of non-accidental trauma. For instance, sternum, the breastbone, scapula, posterior rib fractures or posterior lateral rib fractures. You know, it's a whole process of looking at corner fractures, metaphyseal fractures off the long bones. You know, depends on the age of the child. Are they ambulatory, running around, or is it a babe in a cradle? You know, stuff like that.
Well, do you look at things like displacement or impact to organs and soft tissue around the area?
It depends on the setting. You know, if you have a known trauma, you can have all of that.
Well, but in a situation like this, where the goal is to determine whether or not there was inflicted trauma or not, what are some of the clues that you might look for in making that determination?
Well, there can be associated bruising when somebody injures a child. It can be twisting type injuries that we see, like get the little metaphyseal corner fractures. We look at the eyes to see if there's hemorrhaging in the back of the eye. We look at the brain to see if there's hemorrhaging in the brain from like shaking or things like that.
Okay. And so, since Jameson did not have any soft tissue injuries whatsoever or any indication that those soft tissue injuries were ever present, would that give you any information about the likelihood of non-accidental injury?
Except that he had some previous unexplained bruising
Okay.
at 1 month.
And was that previous unexplained bruising on the rib or thoracic spine area?
I think it was on the abdomen and all 4 extremities.
So not on the posterior ribs or the thoracic spine?
The thought about posterior rib fractures that they were due to squeezing, and so you get 3 or 4 ribs in a row from the pressure together. So that's why that's a little suggestive. I did not see a photograph of the back of those. I saw them all over the abdomen and on all the extremities.
Okay. And a squeezing injury would put pressure on soft tissue, correct?
Usually.
I mean, would there be any way to squeeze without putting pressure on soft tissue?
Not that I can think of.
Did you ever discover anything about the SP7 gene relating to Jameson's testing?
Yeah, there was a variant of uncertain significance in that one, and it's, if I'm not mistaken, it's a, let me look at my note. I don't see it right now. I think it was a recessive, would require 2 mutations to be present. If I can find it. That was not one that anybody was concerned about. Sorry, I can't find it right now.
No, there's a lot of medical records, so we are grateful for the attention.
I saw it, but I don't remember where it is. Let's see. It is recessive, which means that you would require 2 mutations, and it's a variant of uncertain significance, 1 copy in that gene. So it's not even 2 copies of a variant, it's 1 copy of a variant of uncertain significance. You would have to have 2 mutations in order for that disorder, and it's associated with osteogenesis imperfecta type 12.
Okay. So based on the genetic testing that was done on Jameson Timms, he didn't have just 1 variant of uncertain significance. There were actually 2 variants of uncertain significance? Or was
We see
SB7?
this all the time. I mean, we do. We see this. It was found on that second panel that I did, the expanded panel, because it wasn't found on the first one. They only did those 3 genes on the first panel.
Okay. Was there anything else located on that expanded panel?
No, but he had an exome done later that showed he has a deletion on chromosome 15, Q11.2, which the dad also has. Has nothing to do with fractures or Ehlers-Danlos or any of that stuff.
Okay. So those are the three genetic irregularities that were located?
If you want to call them that, yeah.
Well, if there's a better term,
Findings.
findings, okay. And none of them have been found to be benign, correct?
No, the 15 deletion is something totally different. It's associated with like learning and behavior type stuff. The other two were on the osteogenesis imperfecta panel.
And none of them have been found to be benign, right?
They're variants of uncertain significance.
And you did note in your report that Jameson had light blue sclera. Sclera, I may be pronouncing that wrong.
That's right.
The whites, what should be the whites of his eyes were in fact light blue.
Very light blue, yes.
And this is, as you testified earlier, a possible indication of something within the constellation of brittle bones, osteogenesis
It's seen in
imperfecta.
normal infants commonly up to 18 months.
Okay. All right, and approximately how long did you examine Carrie Timms for?
It was 2 years ago. I don't know, 10 minutes, 15, I don't know.
Closer to 3 at this point, actually, so.
Okay,
So-
10 minutes? I don't know, maybe.
Okay. But you are a specialist in pediatrics and genetics. Do you treat a lot of adult patients?
I do see adult patients in genetics.
Were there any other tests you did or observations you made regarding mineralization of bones, either as they appeared in June of 2022 or as they would have appeared in November of 2021, December of 2021, and January of 2022?
I don't know what you're asking me.
You stated earlier in your testimony that there was no undermineralization of Jameson's bones. And so I'm trying to figure out what was the basis for that conclusion that you drew, and if there were any other observations or tests that led you to that conclusion.
Okay, so on the plain films, which are the ones that she was showing up here, to me, they look normally mineralized. The alkaline phosphatase, which is a part of bone metabolism, was normal. And later on, he had a bone density study when he was about 2, I think, and it was normal.
Okay. Right. I don't believe I have any further questions for you at this time, Doctor. Thank you for your time.
Thank you, Ms. Bernard. Ms. Fox?
I just actually have 2 concepts, so it shouldn't take long.
That's fine. Take your time.
Dr. Stevens, you said that an exon is a code for protein. I didn't hear a definition for intronic. What is intronic a code for? Or what is it in general?
It's the space in between, there are exons like this along the genome, and the space in between 2 exons is called an intron.
And you said the exons were essentially the protein code. Does the intron have, or intronic have a function?
Yes, we used to think it didn't, that it was just structural to hold things together, but now we know there are promoters and other things that can be in those regions, and I don't think we really know everything about introns yet.
And what is a promoter?
It's like a factor that may control a gene's function, either the gene next to it or one more distant from it.
And then my second topic, when you were asked by Ms. Bernard whether beta blockers or anti-nausea medicine had an effect, you said no. Why not?
I don't know of any data that says that it has any effect on broken bones in babies if the mother takes that.
Do you stay familiar with the data in your field?
Yes?
Your Honor, that is the last of my 2 topics.
Thank you, Ms. Fox. Mr. Hood? Ms. Bernard?
Nothing further for this witness, Your Honor.
May this witness be excused?
Dr. Stevens, thank you for coming. and
Okay.
You're free to go. Can I see counsel here at the bench just a moment?